Welcome to my channel. You can subscribe and like our video. Effective communication is a key component of successful family therapy. It is important for both the therapist and the family members to be able to communicate effectively in order to make progress in treatment. In this article, we will explore some effective techniques for communicating with family members in therapy. Active listening is a technique that involves fully focusing on what the other person is saying and responding in an appropriate way. It is an important skill for both the therapist and family members to practice in therapy. The therapist should actively listen to each family member and encourage them to do the same. This will help to create a safe and supportive environment in which everyone feels heard and understood. Another effective technique for communicating in therapy is reflection. Reflection is the process of restating what the other person has said in your own words. It is a way of showing that you are paying attention and trying to understand. By reflecting back what has been said, the therapist can help the family members to understand each other's perspectives and identify areas of agreement or disagreement. Open-ended questions are another effective technique for communicating in therapy. Open-ended questions are questions that cannot be answered with a simple yes or no. They encourage the person to give a more detailed and thoughtful response. In family therapy, open-ended questions can be used to explore underlying feelings and thoughts, and to identify patterns of behavior. Another effective technique for communicating in family therapy is summarization. Summarization is the process of summarizing the key points that have been made during a conversation. It is a way of keeping track of the progress that has been made and identifying areas that need further exploration. Summarizing can also help to keep the conversation focused and on track. It's also important to note that in family therapy, communication is not only verbal but also nonverbal. Nonverbal communication includes body language, facial expressions, and tone of voice. These cues can provide important information about what a person is thinking and feeling. It's essential for the therapist to observe and interpret these nonverbal cues to understand the underlying emotions of family members. Finally, it is important to remember that effective communication in therapy requires patience and understanding. Family members may have different perspectives and may not always agree. The therapist should be patient and help family members to understand each other's perspectives. It's also important to remember that change takes time and it's essential for the therapist to be supportive and encouraging throughout the process. In conclusion, effective communication is a crucial component of successful family therapy. Active listening, reflection, open-ended questions, summarization, and paying attention to nonverbal cues are all effective techniques for communicating with family members in therapy. These techniques can help to create a safe and supportive environment, promote understanding and cooperation among family members, and ultimately lead to positive change.